Bismillahirrahmanirrahim. Assalamu alaikum everybody. Thank you, Gazram Shah. My name is Dr. Mohammad Hashim. I am an associate professor at ICVT Sakha. We are already delayed. Without any further delay, we are going to start the session. Before I call first presenter, I would request worthy chairpersons to come on the stage and grace the chair. Dr. Shahbaz Sheikh, Dr. Mohsen Nazir, Dr. Imran Waheed, Dr. Muhammad Arshad, Dr. Arslan Aslam, Dr. Aisha Tariq, Dr. Javed Sheikh. Please come on the stage. My humble request to all presenters, please finish the case within a time. 5 minutes for presentation and 5 minutes for panel discussion and, okay, thank you. I would request Mr. Dr. Jalal from PIC to present the first case. Less is more or face the music.
Bismillahirrahmanirrahim. Respected seniors and dear colleagues, in this learning phase and discussion, I actually want to present a case which actually the name which has been given to the case is basically because it's full of complications, and how to overcome those complications and to share that with you would be a great honor. So here we can see these 3 dots, 1, 2, 3. We actually see 3 dots over here. And the first question which comes into mind is like, what actually these 3 dots are? So while you guess, so we have to listen to the whole story about these 3 dots. Over here, we have a patient, a 69-year-old male who hypertensive, presented to us with anterior STEMI and stable hemodynamics. PCI to LAD was planned, RCA was dominant and no obstructive disease, while circ non-dominant and total proximal disease, as in this view. Here we try to wire the LAD. So the first complication occurred over here, as the wire, the BM wire got angulated over here in the septal branch. So in here in the septal branch, when the wire angulated, we tried maneuver to pull it proximal or slowly distal, but it couldn't move. So the second thing which came into our mind was like how to remove the wire. This was actually the first complication as well as the beginning of the complications over here. We used a wire twist technique and took another BM wire over here, and it was placed parallel to the second wire, and it twisted around the first and successfully removed the wire out of the septal branch. And hello. So after careful wiring of the LED again, we actually pre-dilated the lesion with 2.5 balloon at 10 ATM. And after ballooning, what pre-dilatation, the second complication came into being, which was actually slow flow plus dissection. And to overcome that problem, we actually gave intracoronary nitrates and intracoronary nitrates, and the flow improved, and we actually deployed a stent for the dissection, which we can see over here in this area. So LED stent 2.75 drug-eluting stent was deployed at 12 ATM, and from ostium to ostial LMS to LED, overlapping the second one, another stent was being placed of 3.5 mm at 12 ATM.
You have 2 minutes.
At the same level, what we try to do is we pulled the balloon and actually we played the same balloon at 18 ATM. So the second complication which came into being was no flow, plus this time the patient went into pulmonary edema. We actually treated the patient by giving intracoronary nitrates with no effect, mild mid-LED delivery of nitrate, verapamil, and agrastrate was given through the ruptured balloon with no improvement in hair. So we further took the measures of intracoronary adrenaline, TPA, 5 milligram bolus, IV furosemide. The patient was provided with BiPAP. ABP was actually prepared, but the mean arterial pressure was 65 millimeter of mercury, which we couldn't see the need over there. So here we can see that from TME 0, the flow actually became TME 2, and TME 1, 2, and the flow actually we achieved over here was better. And the segments actually changed, the ST segments were normal. Other than slow flow, actually we did a view which we see something over here, a stuck dot over here. So to overcome that balloon at the tip of the ostium LMS, we can see that this is actually the broken distal balloon, perfusion balloon dot, which actually we gave a name over here as bluebird. We labeled it as bluebird, and we tried to remove all the equipment under vision, but the bluebird remained stuck at LMS. Placement of, we tried to place another wire parallel which failed in order to twist and remove it, but it couldn't, and a snare couldn't possibly cross it. So we tried to push the balloon distally into the LED, but in order not to distort the struts of the stent, that failed and we didn't actually follow it again. So the broken balloon tip at LMS ostium was there. The worst thing was actually losing the guide wire. So over here, another BM negotiated across the guide tip and hang into the aorta over here. So we can see there is another balloon across the balloon. We try to take another balloon across the broken balloon, where we can actually push it distally to the proximal one and remove it together. So here we can see there is another balloon over here, and successfully we departed it over here. But the balloon is actually coming slowly from this part. Actually, when the couple reached at the sheet tip, the broken balloon actually stuck over here again. So we actually tried to remove these cadets together again, but we failed to remove them all together. So while pulling all of these along the sheath, along with sheath dislodges at the exact side, we tried to pull it, but the sheath as well pulled it. We removed the sheath as well a little bit with it. It was complicated, and we tried to twist, took another wire, whisper wire, and tried to twist it again and remove all the cadets again, which actually failed. But at the end, we took a floppy wire, wrapped it around the distal wire, which had been placed in the sheath, along with the sheath, and successfully actually overcame the complication. And this was basically the tip of the broken balloon, which actually we had seen over there at the ostium of the LMS. And this is actually the part of the balloon at high resolution, which can see that the balloon, this is actually the shaft of the balloon, and this is actually the broken part of the balloon, which came out successfully and without any complications. So the conclusion is that what we need to say is complications haven't read the books. If anything can go wrong, it can go wrong. But by improvisation, you can remove most of the dislodged equipment without using any additional inventory. Persistence and perseverance are important in getting out of tough complications. And we have to hold our nose in such a kind of procedures where we face such complications. Thank you.
House is open for discussion. Dr. Zain? Mic them, please.
Wonderful case. First thing I want to ask, how was the status of operator after that case? Was he in sinus?
It was actually performed by an experienced
Okay.
operator, but as you said, things
Like
do.
many things happened. So a few things I just want to say. That first you said that there was wire stuck in the septal branch. So did you try to pull it, or
Yes.
was it broken, or
No, actually we tried a gentle pull, but we couldn't actually
It,
pull it.
it got elongated when we pulled it. So
Okay.
it was not getting pulled and it was not going
Okay.
forward as well.
The last thing, when did you realize that your balloon has broken into the left main? Did you try that mini star technique, that crossing the wire behind the stunt and just giving a small balloon inflation with a smaller sized balloon? It sometimes usually releases the stuck balloon, or was it already broken before you realized it?
We actually said that the balloon was already broken, and we tried to pass another BM wire to cross it and snare it or twist it, but it couldn't cross it. There was a view where we could actually try to cross the BM, but it unfortunately didn't cross the broken. So it
And what
meant
was
that already the
what
balloon
was the
had
size
been
of that broken balloon?
2.5.
2
2 into 10.
2 into 10.
Yeah.
Okay. Thank you. Well done.
Thank you.
Okay, so one comment. So when your wire was stuck, so it's a stuck wire, when you're trying to pull it, जब आप दूसरी wire साथ एक BM लेके गए, single BM, how will a single BM like help you in dislodging that wire? I mean, in my opinion, the strategy you should have adopted is कि आप एक बलून लेके जाएं, उसके साथ बलून को आगे तक लेके जाएं और उसकी बलून के साथ आप उसको पुल करें, या आप एक माइक्रो आगे तक लेके जाएं ताकि जो आपका एंगल ऑफ पुल है वो आगे शिफ्ट हो, वहाँ से वो वायर पुल हो। इसका यानी यूजुअली वे तो ये है, जो एक सिंगल BM वायर उसके साथ, और एक सिंगल BM वायर जो है वो अमूमन चीज़ों को इंट्रैप नहीं करती। अगर आपने वायर के साथ चीज़ों को इंट्रैप करना है तो द मैकेनिज्म वुड बी कि आप 2 या 3 वायर्स को लेके जाएंगे, उनको फिर एक सिंगल टॉर्कर में से गुजारेंगे, वो सिंगल टॉर्कर में उनको स्टक करके देन यू वुड रोटेट, तो वो फिर एक स्नेयर की शक्ल बना के उसको ट्रैप करेंगी। आई डोंट थिंक कि वो जो एक वायर आप आगे लेके गए।
So Dr. Aslan, you know, do you remember the scene after that's called the complication number 1, which was the broken wire?
Yeah.
So do you remember that scene, or if they can play it again, you can see that in this scene it's recorded that the wire is wrapping and moving the other wire out. So,
Okay,
that's clear. So, you know, we have broken wires, broken balloons, broken stands. All the high volume operators come across these complications. I hope you all have those. And I agree totally with that. The bookishes take 3 wires, you know, then the shaft of the wire which are outside the body, take them into one torquer and rotate them together. You know, we do multiple, things which were different from the book. Actually, the complications which happened, we didn't read them in the book in this case. But again, this is not, I haven't read in the book, and I haven't seen anywhere any operator doing that, getting the wire, broken wire out with the single wire. So the lucky thing in this was that the wire which was stuck was elongated, but it was not broken altogether. Second thing, you see, the trick in that is, if you want to remove something, which I learned in this case, if you want to remove something broken with a single wire, you have to twist the radio-opaque part of that wire. The ideal wire for that is C-on, because it is one of the most robust wire and it never breaks. And the least favored is BM. The BM was stuck and elongated in this case. Although we do not have access to the C-on, so we use the BM in this case. And the radio-opaque wire was twisted over the radio-opaque wire. When you do that, one will bring the one out almost always, to me, after this experience. The second thing, totally agree. Previously, I always take personally 3 wires at least. The one which is already there and 2 more, or maybe 3 more. So 3 at least. And as you see, when the sheath for this broken stuff was in the radial, that took more time to get it out from the radial as compared to the left main. And we took 3 wires, we took 4 wires. They are seen because of the shortest time, they are run only 1 or twice, and then you move on to the next slide. But they are recorded seen in this here, which was shown that all the 3 wires, their twisting was shown around the proximal part of the radial artery, and they could not do that. Okay, what trick again worked over there, that there were 2 wires beyond that, and 1 wire was wrapped locally around the balloon over there. And the 2 wires, they were in the torquer, they were rotated clockwise, and this third one was rotated anti-clock. So somebody told me do Wernicke and do flan, this and that. We didn't want to injure the radial artery itself more. That's why we wanted to be as much less invasive as we try. So that's why we worked more on this radial. That took more time for us. And so again, in the second last scene, it's shown that the balloon is actually wrapped with the radiopaque part of the third wire, which is rotated in the opposite direction.
And second thing, I did not understand, balloon कैसे break हुआ? Pull करते हुए stuck हुआ था और वो pull करते हुए break हुआ. Balloon break
The
कैसे
$1 million
हुआ?
questions in this case was, when you saw 3 slides. In the 3 slides, there were 3 or 4 cine which were showing slow flow,
Exactly.
which was not improving. And this balloon, this was a 2 or 2.5 something balloon, which was ruptured by making side hole,
Okay,
which
for
we used
distal
for drug delivery.
Yeah, okay.
And it
sorry.
was used 2 or 3 times, and on this way back, it got stuck into some of the strut of the left main, and the operator pulled the balloon, and it got broken over there. And when after the slow flow improved, only then the operator had the time to look at the entire of the stent and everything, and then he noted this. During all of the slow flow, it was probably missed. And the second thing is, when he looked at this and then he looked at the balloon sitting on the tray, the distal part was not there. So probably that was the reason that puncture in the balloon and recurrent use of that.
Okay, so distal drug.
Thank you very much.
Distal drug.
Sir,
delivery-
in the interest of time,
yeah, I
just
understand.
last comment, please.
ओके सो डिजिटल ड्रग डिलीवरी के लिए हम लोग बलून रप्चर करके इनको यूज़ कर रहे हैं. उनको रप्चर करते हुए भी लाइक नीडल से अगर किया जाए तो अच्छा है. अगर उसको ब्लेड के साथ किया जाए दैट इट कैन ब्रेक, तो इसलिए लोग यूज़ तो
I just wanted to ask, what was the final result? Did flow improve in circ also, because there was slow flow in circ and almost no flow?
No. There was nothing for the circ. The circ was a small and non-dominant and total proximal occlusion. And the plan here was in the acute setting of anterior MI, only from the left main to mid LAD. And the case was like, 1 hour and 20 minutes or something. And the most amount of time was actually, used to stabilize the patient and improve the slow flow, rather than getting the balloon from the left main on the radial.
Thank you, doctor.
Okay, thank you. No more questions, please.